All right, it's 5 o'clock, and as Kentuckians, we're together once again to talk about the coronavirus, to have an update, and to recommit ourselves to doing everything it takes to better protect one another, to do our duty as a Kentuckian and a patriotic American, and to recommit to making sure that we defeat this virus on the very first try. I'm assisted today by both Virginia and Kenneth. So let's start the way that we always start, by saying what we know, that we will get through this. We will get through this together. And I'd like you to say it with me. We will get through this. We will get through this together. One more time. We will get through this. We will get through this together. I not only know it in my heart, but in every single bit of planning we're doing, and any of the data that we see, while we are fighting for the health and the lives of many Kentuckians, I want you to know that we will make it through. And as we are now at least a couple weeks into this, I know it can be hard not knowing when it will end. But this is not forever, and we stay determined, we stay strong, we protect the people around us, and it will end. Again, we will get through this. And one of the reasons that we'll get through this is the amazing attitude that so many Kentuckians have taken. At a time when it's causing unemployment, it's causing anxiety, so many of you have grabbed on to the positivity that we so desperately need, and are modeling your behavior out there on social media, and finding amazing different things that you can do to make sure that you are showing other Kentuckians the very best of us. And so I want to start by looking at that. All right, this is Dr. Aaron Thompson. He heads our post-secondary here in Kentucky, and I just thought that this was a much-needed message, that we all have times in this, me included, where you just got to turn off the news, you got to put down your phone, and you got to go for a walk, get some exercise, take a minute with your kids. One of the ways that we get through this for our own emotional health is to make sure we can turn it off at different times and just be people, just be what we now view as normal, and just take a minute to breathe and to realize it's all going to be okay. This is the city of Hazard. The city of Hazard and Perry County has certainly come together in how they are fighting this coronavirus. I thought this is pretty special. Normally this is something that you see for firefighters, for police officers, and they are on the front lines of fighting this coronavirus, but so are healthcare workers. And I thought this was really touching, because every day our healthcare workers without enough personal protective equipment are going into danger each and every day, and some of them are becoming infected with the coronavirus, but they are doing it because they know the people around them need their help. They are passing that test of humanity. This is another special one of so many people out there that are working to create as much personal protective equipment that can be used in some capacity out there. And just the act of it, I think, makes us feel like we have just a little bit of control, like we can do something about fighting this coronavirus. And when it's something we're facing you can't see, it's hard to feel like we can do something about it, like we're in control of our surroundings. But let me tell you, I want you to not only do things like this, but remember, when you're engaging in social distancing, when you're pulling up to that grocery store but there are too many people there and you say, I'll come back later, you're doing the same thing. You are doing your part. You are making an active decision to not spread this virus or put yourself in a place where you could get this virus. So understand that while it's really hard, again, to internalize, that you do have a lot of control on how much this virus spreads and whether we can indeed flatten that curve and have the healthcare capacity that we need for our people who are going to get truly sick. In fact, we may have more control over how we defeat this adversary than in the last generations and that they faced. This is truly on us and we know the steps we have to take to flatten that curve and make a difference. These are green lights that were put up not last night, but the night before. Just everybody finding a way to honor those that we have lost, to show compassion, and also talk about renewal. Again, making sure that we can find ways to still connect. Being healthy at home doesn't mean isolation. And we have more technological tools than ever before to stay connected. In many ways, we might be the luckiest people to ever face something so difficult. If you look back at the Spanish flu, which we talk about a lot, they didn't have this. I mean, when they were inside a home, there was nobody else that they were going to talk to. So make sure you use this. And my kids now are doing it just about every day, either with their classroom or with their church or with their friends, and I can tell you it makes a big difference. Take advantage of that opportunity. This is Magoffin County. This is their county judge doing their part as well. And you know, some counties in eastern Kentucky haven't had their first case, but this is somebody who gets it, who knows that just because we don't have a confirmed case that it is in their community, and that we are also one state all together. And when we lose a Kentuckian anywhere, we've all lost. I love this for a number of reasons. The first is telehealth. We can have more telehealth now than ever before, and if your pet can get what they need through telehealth, you should be doing it. Because even a clinic is a place where people can come together and ultimately have more contacts than we want. But there's also telehealth in virtually everything else right now. If you have a routine appointment, it ought to be telehealth. And look, I mean, if a vet clinic can get there and can do these things, so can everybody else. These are the bells ringing in Hopkins County. Again, at 10 a.m. every day, making sure that everybody knows that we are not alone, that just because we are healthy at home, and we should be in our house unless we are getting physical exercise or going to work or going to the grocery, that we are all still connected. All right, we have a new graphic tonight. It's about 10 steps that everyone can take to battle the coronavirus. It's one where we're trying to make sure that we're putting all those steps that people need to take into one place. Remember, stay healthy at home. Our directive is you should be at home if you're not at work or the grocery store or getting exercise. Number 2, avoid crowds and gatherings of any type and of any size. 3, social distancing. 4, know when to seek care. If you are well but nervous, don't go to a healthcare facility. Call our hotline. If you are sick but wouldn't have gone to a doctor but for the coronavirus, call your normal healthcare provider, but don't go in. Otherwise, if you are truly sick and need help or you are injured, make sure you get the care that you need. 5, the coronavirus website, kycovid19.ky.gov, is your source for reliable news. 6, wash your hands. I've been saying that every time. Wash them and wash them a lot. Just because we're 2 weeks in doesn't mean 2+ weeks in that you should be washing them any less. You should be washing them that much more. We're in the surge, and we know we're in the surge, so make sure you do this. Also use disinfectant for surfaces in your home. Remember, if you can't get disinfectant at a grocery store or another place, a 1-100 bleach solution works. We have that up on our website about how to do it. 7, apply for benefits. I know many people out there have had issues in applying for unemployment. Let me tell you that we are working on it. We have hired numerous additional people. I believe we've got 50 new working in one area and 100+ working in another, and we'll have a full update for you on that. All I'd ask is try to have patience with us, and I know it's hard. We said that it's open now for virtually everybody, and we mean it. It doesn't mean the system catches up as fast as we want to move. We will work to process your claims, It will be okay. I know it creates anxiety, but we will work with you. And if you've had something coming back saying you've been denied, we're going to work on it. We're going to make sure that you get the benefits you need. Also, make sure you sign up for Medicaid. Everybody needs health care right now. 8, prioritize your mental health. As you all know, we're going to be in this, not for weeks, but for months. We need to stay mentally and emotionally strong. Do what it takes. 9, do not travel anywhere. And we're going to talk about that. We have a new step on that. But all you should be traveling to is work or the grocery store or maybe to a place that you're getting exercise. That ought to be it. We're no longer talking about travel being airplane or cruise ship. We're talking about travel being anything. And finally, if you see something that's dangerous, give us a call. We at least want to encourage folks. I had calls today with both Home Depot and Lowe's. We got some very positive response about new and additional steps that they want to take. We got acknowledgement that in some instances there have been crowds in certain areas of the store, and they're making changes on that. That's what we want to see, and we'll be watching to make sure that those happen. All right, a couple of updates / some good news. Been asked about the 1-year-old in Fayette County and an update on them. They are at home. They have mild symptoms, and that kiddo is doing really well. Also, a big thank you to Clayton and Kroom, which has changed their manufacturing from leather to face shields, and it looks like they're going to be able to help provide us with some face shields we need. Thank you to those 2 individuals that run that. All right, I'd now like to show a video. You know, we had Coach Cal who talked about ways that we can help and things that people can do. We've got a football coach from another school because we said we'd include everybody with a short message for us, and then I'm going to come back, talk about how critical, again, these next weeks are, and give the update.
About being a great team.
Audio.
A lot of our local teammates need our help right now. They have temporarily lost their jobs because of the COVID-19 pandemic. That means they are having a hard time paying their rent or buying groceries. There are many ways we can help these families through the local churches and charities. You can also help by donating to the Team Kentucky Fund, which was set up by Governor Beshear and is administered by the state. Your tax-deductible donation will provide financial assistance to Kentuckians whose employment has been affected by this pandemic. 100% of your donation will go directly to Kentuckians who need our help. I hope you will join me in donating to the Team Kentucky Fund by visiting donate.ky.gov. And please do everything you can to stop the spread. Practice good hygiene, use social distancing, and stay home, especially if you're sick. We will get through this together. Thank you, Louisville. Go Cards, and go Team Kentucky.
Like I said, we are all in this together, and that includes regardless of the university that anybody out there roots for. I want to thank Coach Satterwhite. I want to thank Coach Cal. I want to thank everybody else that you're going to start seeing messages from. I just think it's helpful. The more different places that we hear it from, not just from me, about the things that we can do to better protect people. All right, so the next at least couple of weeks, folks, are really, really critical. And the amount of social distancing we do and the amount of contacts that we can decrease is going to make a huge difference on what we're going to see going forward. And I believe that you out there are doing well. I mean, we need to do better. We have to do better. I mean, the lives and health of our people depend on it. But you are working really hard at it. I want to show the CDC's map as of today. So this is what the CDC shows for our country. And as you can see, at least as compared to most of our neighbors, you are working very hard. And that's one of the reasons today that I have issued a new executive order that instructs Kentuckians not to travel to other states, but for a very few small exceptions. As you can see, right now we have more cases in other states That doesn't mean that they're doing a good or a bad job. What it means is your likelihood of getting infected and potentially bringing back the coronavirus may be greater in other states than ours right now. And really, you need to be at home. You need to be healthy at home anyways. So to give a little more detail on that, I've asked my Chief of Staff, Latasha Buckner, to talk to us.
Thank you, Governor. So the governor's given the reasons for these new directives, and we want to kind of focus on some of the things that you can still do. We want you to go out of state if it's required for your job. We want you to go if it's you're on the border and you need groceries or medicine or other supplies that are necessities. We want you to go out of state if it's required for your health care. If you have a loved one that you need to care for, someone who can't leave their home, we want you to travel for that. And if a court requires you to travel. What we don't want is your favorite barber is across the state line. We don't want you to go for that. The weather's turning really nice. We don't want you to go for pedicures. We want anyone from Kentucky who's been out on spring break or for a trip to return home and self-quarantine for about 14 days, just to make sure that you haven't been exposed and don't expose other people. We want you to remain healthy at home.
So the order does require that if you travel to a different state for any reason other than those exceptions, that you will be required to quarantine for 14 days. So it's an important order. Let's make sure we follow it. Kenneth, can we see the Kentucky-Tennessee map? You know, I've been told that Tennessee is about to enact some additional restrictions. That's good news. But we continue to hear from county judges. The Simpson County judge called me today, actually, about concerns with the number of cases on counties just south of Simpson and Todd and Logan County. They continue to significantly rise in cases. This is just another reason why this order is so important. We don't need to be traveling to other states right now, but we don't need to be traveling at all. And there are a number of other states that have entered orders very similar to this. And so again, let's just make sure that we internalize this step. And we are all in this together, but we are definitely Kentucky first, and we want to make sure that we protect our people to the maximum extent possible. Now I want to show you kind of a new slide that we've put together, which is based on our Philadelphia versus St. Louis, again to talk about why we're doing what we're doing. So here is Philadelphia. You've seen the other slide before. They did not engage in social distancing. They, in fact, held a very large parade post-World War I, and 2 weeks later or less, a lot of people died. And this is actually a map about death toll, not cases in and of themselves. Let's do St. Louis. So this was St. Louis, which initiated their steps a lot earlier, initiated social distancing earlier, but let up a little too much, a little too early, and look, they had a second outbreak that was in fact deadlier than the first. I'm going to show you one new one. So this was Louisville during the Spanish flu, and Louisville did not act as quickly as St. Louis, and they had a tougher time in the initial surge. But what I want to point out here is Louisville did react stronger when there was a potential second wave, and look at what they were able to do to minimize the harm that came out of that. Listen, our goal is to be St. Louis with this initial surge, but it's to be more like Louisville, more like what we did in Kentucky, about keeping with it and making sure that we don't just protect people in the initial, but making sure we get this right and we defeat the coronavirus on the very first time. So what I feel, what I think when I look at this graph is that very first bump, that's our commitment. That is what we have been willing to sacrifice and what people are sacrificing right now that aren't going to work or whose businesses are closed. This is a sacrifice when there's a really nice day out there about making sure you go out for a run on your own and you're not congregating with other people. That is the sacrifice we're doing right now. The second bump is our persistence, is our strength, and is our endurance. And we've got to both be willing to sacrifice right now and have the strength and the endurance to make sure that we defeat this adversary on the very first time. And the reason that we have to ultimately flatten this curve and make sure we don't have the second bump is our state resources, our healthcare capacity. Kenneth, can you show that slide? So this is before our work in expanding the healthcare capacity when we need. These are our hospital beds, and these are our regular hospital beds. There are a lot of other beds out there that we're going to be able to use. We have plans right now on converting hotels when we need to. My goal is to increase the capacity on as many of these as we can, 18,500 hospital beds, 1,300 ICU, and 1,352 ventilators. I can tell you we already have good plans to increase the hospital beds by more than 10%. We need to do better than that. We're working on it. And on the ventilators, I believe we're going to be able to increase that by about 10%, depending on the location and collection from outpatient centers and from other areas that we're looking at right now. These are the numbers that in the short term we have to improve. One other piece of good news is our student volunteers. Our Commissioner of Public Health, Stephen Stack, sent out a letter asking for help, and we're going to need help, in any of those bumps we see. And right now we have 632 student volunteers already, 342 from med schools, 210 from nursing schools, 43 from pharmacy schools, and 53 others. That is pretty special. That's pretty special of people coming together. That's pretty special of what Team Kentucky, I think, is all about. So today's update has some good news and a little bit of tough news. Good news is that we only have 42 new cases, one of which is presumptive, but is going to come back as a case. That means our total number of cases in Kentucky is 480. Now, the reason this is good news is that other states are seeing really a doubling just about every 3 days or less. And remember, 3 days ago, we had a little over 90 cases. In the last couple days, we've had about 40 cases. Now, that is a good sign, but we are in the surge. We are in the escalation. So I think that it shows that our actions matter, and we'll ultimately see where our curve ends up. But no, we're probably not going to have many more days in the next couple weeks where we only have 42 new cases. This is a good day because of that. The new cases are 17 in Jefferson, 8 in Fayette, 3 in Bullitt, 2 in Woodford, 1 in Marion, 1 in Campbell, 1 in Marshall, 1 in Christian, 1 in Warren, 1 in Clark, 1 in Kenton, and 1 in Boone. But remember, just because you haven't had one confirmed in your county doesn't mean the coronavirus isn't there. It is. And because of that, you have your two duties we talk about every day. Number one, to protect yourself and your family by doing the things that would prevent you from getting the virus. But number two, treating yourself like you have the virus and doing things to prevent you from spreading it. Remember, if 80% of people are asymptomatic or maybe have mild symptoms, you can be spreading it thinking you don't have it. So remember, those are the two things that we need you to do as a patriotic American and fulfilling your duty as a Kentuckian. Now, the tough news is that we have 2 deaths today. One is presumptive, but it's going to come back as being positive, and that is an 88-year-old female from Kenton County. And then we have a 90-year-old female from Simpson County. Both had some other health conditions, but the coronavirus was at least a contributing factor that took them from us. Remember that these are families are loved, are people that are loved by their families and by their friends. This is a loss for all of us. And let's all send our prayers and our best wishes and feelings for these families. And let's also light everything up green tonight. The governor's mansion and the Capitol will both be green. It probably doesn't mean as much to people as you lighting your house up green or doing what you can. People seeing it out in their communities. Maybe people expect me to do it, but it means so much when you do it. Again, it means we're all in this together, that we all share compassion, and that we're all looking out for each other. I believe last note is we believe that right now we have 2 positive tests from a Northern Kentucky nursing home. It includes 1 staff person and 1 resident. The resident is in a hospital, I believe, is not currently in the facility. They are testing at least 4 other folks in the facility. That's all the information we have on it right now. We believe at least the 2 people may have been symptomatic about at the same time. So let's see exactly what comes back in that second round of testing. It does look like there was a quick response, at least when people could tell that there might have been symptoms there. We also estimate, and I'm giving a bigger ballpark number now, that the total number of tests in Kentucky, and these would be individuals, because each individual often has two separate swabs, that we've had between 15,000 and 21,000 individuals tested in Kentucky. We are still working on getting better and more accurate numbers on that. I've been moving fast today, and because of that, we're going to start questions at just 30 past. And again, we'll go back and forth. We have 3 of our reporters here with us, and then a number of questions that have been sent in. Catherine, you want to start us?
How will that executive order be enforced?
The question is how the executive order will be enforced. And the answer is, while there are enforcement can be done on any of these executive orders by law enforcement or county judges or others anywhere, the reality is the only way that we're going to get people doing the right thing is because they agree to, is because they see it as their duty, and they know that their actions can harm other people. That the moment that you go across the border, whether it's to get your hair or your nails or something else done, or to go to a store that's not open in Kentucky. And I was just going off different stories that we'd heard directly. And you have that extra contact, you can bring it back to a person in your family that's working in a nursing home. So we're gonna continue to encourage the very best behavior, make sure that our instructions are very clear. Though with different stores that are out there that become overpopulated with playgrounds and the rest, we are asking our county judges and our mayors, when they see something that ultimately needs to be closed and can be under one of our orders, to go ahead and to take those steps, even if it's just temporarily. All right, several questions about unemployment claims, because they're getting a lot of calls from people having trouble getting through. I believe we have 150 new employees coming online to help that. And yes, there have been issues with it, and yes, we need to fix it. These are more claims than this state has ever seen at any time, but we're committed to making sure that we help you. So stick with us, and I know that's, if you lost your job, probably because of an order I put in, and now you're having a tough time getting benefits, which I told you would get, I can understand how you'd be frustrated and upset, and probably with me, and that's okay. I promise you we're going to get it fixed. I promise you we're going to get your benefits. Just stick with us. Here's the extra. Today we added 120 people to the phone lines to help answer questions, file claims, and aid in the adjudication process, and we will add 50 to 100 new people each day for the foreseeable future. Got a question about employees at GE in Louisville expressing concern about parts of the plant being dirty, as well as employees working less than 6 feet apart without barriers. We are continuing to talk both with the workers at GE and with the facility itself. My hope is that we can come to a place where those who are going to work feel safe, and that there have been significant steps taken by the employer as well. Joe?
Our Lady of Belafonte, the hospital in Ashland, expected to be open for another month. Do you expect that in the case of a surge of patients that will be able to stay open longer than that to treat patients if necessary?
So the question is about a hospital in Ashland called Our Lady of Bellefonte, and it before all of this had announced that it would be closing, and there have been a couple different dates, but one may be about a month away. And will it be needed, and will it be used if there is a surge of patients? The answer is absolutely. That is a hospital with beds that, while in the future, if it was going to stay open, needed infrastructure help and upgrades, it is going to be a hospital facility for people to be able to go to during this. And our plan is absolutely to use it. And especially as this surge is coming, we're going to want to make sure that it's open for more than the next month. We are looking at ways to where we can help rural hospitals. Our plan isn't fully completed yet, but wanting to make sure, even if it's going to be 3 weeks or maybe even 4 weeks until we're going to hit their full capacity, we need them there and ready. And there's going to be plenty of patients, unfortunately, for them to help out. This question is Amazon going to get the governor's blessing to reopen the warehouse in Shepherdsville as planned on Wednesday. We asked them to close until Wednesday. That was my request. They have taken the time. It's given us a chance to try to follow up on those that tested positive and trace their contacts. So yes, I did ask them to close until that date, and so yes, they would have my blessing on reopening on that date. And I understand that there are those that might be going to work there that don't think that they should, and that's a decision that folks are going to have to make. You've got the opportunity, if you don't feel safe, to potentially sign up for our benefits. But when we ask these companies to take these steps and they fall under our orders of being able to stay open, when they've done that period of time where we think we've gotten a head start, then yes, we have to support the reopening as well. Phil?
Can you talk a little bit about your conversation with Lowe's and Home Depot, what you all talked about, and specifically what kinds of things are they going to be doing to have some more social distance?
The question is, my question with Lowe's and Home Depot and what they're going to be doing to enforce social distancing. They actually had a big list. And I called, and I will tell what I said to them is we got to do better. We got to do better than what we're seeing in some stores, and they agreed. And their commitments are everything from limiting number of folks that are in the stores at any given time, are having different waiting periods and strips down for people, on having some different checkout options. Each of their employees is going to be wearing social distancing paraphernalia, and they're going to be trained on what they ought to be doing, and more training on encouragement of others that are in there. They've recognized that with a really nice day and more people at home, that their gardening portions have had more people at them than ever, and so they're going to take some additional steps there. I found it responsive, but we also got numbers that we could call immediately when we're seeing things that are out there. But now let me say, while I pushed on Lowe's and Home Depot, it's also on us too. That if you pull up to a store and there is a crowd, come back later. I mean, this is our responsibility not to spread this virus either. And Kenneth, if you'll go back to the top 10, the 10 things that we recommend for the coronavirus, they're about avoiding crowds. And so if there is a store that has a crowd, don't go in it, because what you do is you contribute to that crowd. Order online if you can. Do everything you can to not be a part of the crowds that we are seeing in there. Question from Valerie Spears in the Herald Leader. Does the president extending no social contact until the end of April mean schools won't be open until the end of April? This order just came out a couple days ago. We are trying to get a little more data before we make that call. But what the president extending that order does say is we're going to be at this longer than we might have thought in the very beginning, and that we are likely not to see our peak number of cases in Kentucky. Right now we think until May, and we hope in early May. But again, this is all based on very limited data. So what we'd like, given that we originally had school out until, I believe, April 20th, which is a lot longer than many other states, or the president had been recommending that guidance. So we want to give it a couple more days or even a week until we have to make that next step. Looks like from Tanner Holbrook in Evansville, we've been receiving tips about a few churches holding services still in Hopkins County, specifically in the Dawson Springs area. So my granddad was a minister in Dawson Springs his whole life. He would not have wanted people going to an in-service congregation. He loved his congregation. He loved it. And while he was while he was very strict on the scripture and would always want a service to be performed in the way he believed, I have no question in my mind, knowing him, that he would be telling people that they should not be coming to an in-person service. And Dawson Springs is a small town. Most people there, at least over 50, knew my granddad, Russell Bashir. My goodness, please, don't put people in harm's way. God wouldn't want it. He gives us wisdom, and knowing the coronavirus has spread in churches and would spread in your church, as Dr. Stack said the other day, I want you to think about whether, if at Christmas 15% less people are in your congregation because the coronavirus spread to them and they didn't make it, is it worth it? I believe we are called to be good servants. I believe we are called to exercise the wisdom that we have been given. Please, don't make it a test of faith for people to come to a service in person. Have I considered shutting down Kentucky's borders so as not to let drivers in the state from other states? What we have done is our executive order today instructing Kentuckians not to travel to other states, but for a few exceptions. Joe?
Are you going to sign Senate Bill 150, the coronavirus bill that General Assembly?
The question is, am I going to sign Senate Bill 150, the coronavirus bill? I just signed it about an hour and a half ago.
Are we closer to having drive-through testing?
The question is, are we closer to having drive-through testing? Yes, I believe we're closer than we were yesterday. But I still want to see us hit some benchmarks, and I still want to see the supplies sitting in front of me at a warehouse or where they're going to go. While I believe right now, and I still hope this week we can have this announcement that we've got a good supplier, and I know we've got a good partner in it, I just got to see the proof. I've never believed in false hope. I don't want to spread false hope, and I desperately want this plan to work and to be a model across America. But until it's here, I want to make sure that I'm not telling people that it's here and it's ready. I mean, I've got big hopes and ambitions on what we can do with testing, and we've been working every day to try to put us in the front of the line with some groups out there that could partner to do it. And I believe that we are close, but I've just got to see the test kits and the personal protective equipment. Phil.
Following up on that, will the testing be in one location, or will it be spread out in multiple locations?
It's about where the testing would be, the drive-through testing. What we will do is we will do our initial proof of concept testing in one location, probably serve just a couple of counties to realize where our challenges are. Also, what our capacity is, how many tests can we actually do per day, and with how many lanes, how much personal protective equipment that we go through on that couple days that we would be testing it, so that we know that we can scale it out. I want to make sure that when we scale out to a location, that we can at least do a couple of weeks. But our goal is to hopefully go from a test site within a week to have at least 3 sites, and then hopefully within a week to 2 weeks from that to significantly increase those cases. And my commitment is, as long as we can get the equipment, and as long as we have the capacity, we're going to have it all over Kentucky. We're not just going to do it in what the federal government would call hot spots, and if we looked at Kentucky, those are our major cities. It's just as important in other areas to make sure we are detecting and then preventing. Because in other areas, if we can test people who are positive and who come back and we can isolate them, and in those areas we can do the contact tracing, we can make sure that it doesn't spread in other areas as much as it may have spread in our larger urban centers, and that's happening all over Kentucky. Can I provide more details on what's happening at the fairgrounds? Who is in charge of the operations in the site? Are they distributing PPE, staging medical facilities? We are just at a very initial, almost site visit planning stage. And for anything we would do at the fairgrounds, it would take the federal government making a significant commitment and saying now is the time for Kentucky. And so I answered that question yesterday about are we looking at it? Yes, we're looking at it. But there are probably other options, including hotels that we would turn into hospitals, that we would do not before we would start that plan, but what would have to happen at a place like that if at a facility where you have to put in the beds and the rest, as opposed to a hotel that already comes with some infrastructure and some food service, it takes a little bit longer. All right.
The Northern Kentucky nursing home where there were 2 positives, what county was that?
The county that the Northern Kentucky nursing home is in. Can we get that? I don't want to guess, but let me make sure that we can find that one. Catherine or Phil, anything else? Just one more.
You said the draft plans yesterday for releasing visitors. Can you give any more details on what those plans are and when you plan on acting?
So I've been asked about the plans on the potential release of inmates in our state-run facilities. So we're looking at initially 2 general populations, those that we could release early but don't have significant years on their sentence, because there are some that might be scheduled to be released in the next 3 months but could have 10 more years on their sentence, but they're getting out on probation. The only thing that I can do, as opposed to the probation board, is commute their sentence, and that requires a commutation of it in its entirety. So we're looking at the portion of the population that it is realistic to do. And then we have the medically fragile portion of the population that committed nonviolent, non-sex-related offenses. And the reason it's taken time is we're trying to get it right and to make sure that we do it in the right way. You just want to tell me? Okay, Campbell County is the county of the Northern Kentucky nursing home. All right, folks, we were able to do this today in 45 minutes. So again, I want to thank everybody out there for all the good work you're doing, but we got to do a lot more. I'm hoping starting this week that we can actually show in some graphs where we are with our cases versus where we need to be on social distancing. And what you'll see is we need to do better. It's hard when it goes day to day. It's hard with the anxiety and not knowing an absolute end date. But I can tell you that every positive decision that you make helps save lives and protect people's health, and the negative decisions that are made put people in harm's way. I say every day, this is the challenge of our times. We didn't know as a generation that we would face something like this. In many ways, it's like something that we've read about those that we lionize and we think so positively about in the past. So this is our chance and our time. And what we're being called upon is simply to follow the rules and to stay home. But think about that. If we are the generation that had to, in a way, stay away from each other in the most connected world that we have ever seen, and we were willing to do it and to make that sacrifice and to protect each other, if we were able to take on a worldwide pandemic and come out of it better as a state than we have ever seen, that would say something about us. That would say we are also a great generation of great people. And it would mean that we've passed the humanity test where we care more about each other than either our bottom line or about getting out and being able to do the things you'd normally be able to do in your life. So I'm going to end, and we got a video, and it's a video of our young people that, we showed the one the other day of the kids kicking around the toilet paper, and it was creative, but it also meant they were healthy at home, They were finding creative things to do, and we really want to model that behavior. And I really want to recognize our young people may be sacrificing more than a lot of us, and it's harder in many instances for them, and probably more isolating in many instances before. So I believe what we're going to show you is McCracken County High School. And they were supposed to be performing Grease last night. And I know it's hard to miss that opportunity. And they made this video, which is about 2 minutes, for their teachers. But it also shows us how much we can do electronically, how much we can still stay connected with each other, even when we have to stay 6 feet apart. And I think y'all will enjoy this. Thank you.